This is a video that we're using to demonstrate to clients how to counter condition and desensitize their dog to aspects of a veterinary exam or a veterinary visit. This video specifically will go through how to teach your dog to be comfortable and relaxed about gentle restraint and manipulation of their body, and then also walk through some of the basic aspects of an exam, such as giving vaccines, looking in the ears, looking at the teeth, and things like that. These techniques, when you are doing them at home, it's important to remember that it is a lengthy process. So we're going to break it down into little tiny steps and move slowly for the dogs. For the purpose of this video, we're showing all of the steps in a row so that we can show it to you. But be aware that if you do this at home, it does take some time instead. Counter conditioning and desensitization, for people that don't know, is a process that we use to get dogs comfortable with things that they're afraid of. The basic idea is that you take something the dog considers scary and you break it down into tiny little pieces and pair it with something that the dog really likes, in this case some chicken. Pair it with something they really like so they become more relaxed about it, and then slowly add the pieces back together until the dog is comfortable with the entire thing that used to scare them. All dogs are different, and the counter conditioning plan will be unique for each dog. This video is to provide a general outline of the type of training process that you can use, but if you want to do this with your own dog, please contact one of our team members or schedule a consult so we can help you come up with a truly unique plan for your pet. When we're doing this technique, there are a couple of different options for delivering the treat. To start with, you want to get something really high value, so chicken, roast beef, cheese works well for some dogs, and then figure out which treat delivery technique works best for your dog. There are additional videos that demonstrate the individual treat delivery techniques, but as a basic overview, there are two techniques. One is called open bar, closed bar, which is a technique where the food is presented simultaneously to the handling, like such, and the dog is fed a treat the entire time the handling is occurring. When the handling stops, the food stops as well. The other treat delivery technique is called pay-as-you-go, where the dog is paid or rewarded for each individual piece of handling that occurs. For example, when I'm petting Maddie's head and looking in her ears, yes, and then I reward her for that handling afterwards. So to start with, we teach our dogs how to be comfortable with the restraint process. Many dogs feel very nervous when they're confined in any way and they're not sure what's going to happen. Teaching them that gentle restraint is not scary and is actually a predictor of good things makes their process of coming to the veterinarian much easier. The standard restraint that we have you guys teach your dogs is a standing restraint. This is a restraint that can be used for almost any basic treatment that we need to do to a dog. The end result looks something like this. Come here. Good girl. Slide you forward. With one hand underneath the dog's belly, the other hand gently across their chest and neck. This allows the technicians or doctor to have access to the front legs, the back legs, feel pretty much all of the body, and also look at the head. Yes. And that allows for complete control for anything that needs to be done. So for teaching the dog to be comfortable with that, there's a couple of different options. For dogs that are generally okay with being hugged or touched, you can typically start by going right for the full kind of hug. With those dogs, we're basically going to teach them that this is just another type of hugging and cuddling that they'll enjoy, and then work on slowly adding duration and adding some snugness. So when we first start at home, we would have you stand with your dog, start with just a very brief 1, 2, 3 second hold, release, and then reward if you weren't feeding the entire time. As the dog gets more comfortable, we'll move on to having a little more snugness, so the dog is pulled closer to your body, and have your dog comfortable being handled for say 20 to 30 seconds at a time before releasing. For dogs that are more nervous about handling in general, that wouldn't tolerate having somebody just come down for the hug process, we simply break that down into a few different pieces. What I would start with, is one hand flat, right here, under the belly. with a standing patient, thank you. One hand under the belly for just a couple of seconds, yes, and reward. So again, that would be 1, 2, and release until the dog is comfortable with that. Once the dog is comfortable, you continue to add more time. When you can have your hand kind of flat under their belly for say 10 seconds and the dog is completely relaxed, they're probably ready to move on to the next stage. Once the dog is comfortable with the flat hand, you would start simply curling your hand around so you have a slightly snug hold on your dog's belly. Over time, as they relax about that process, we would move a little more snugly so the dog feels more confined. It's important to remember that we never need to have the dog in any kind of a really hard, really firm hug. We're not trying to give them a headlock or anything. If your dog is feeling anxious enough that they're going to try to fight and you feel like you have to hold them still, then they're not ready for the stage of training that you're at. Once your dog is comfortable, stay, with the hand snugly around their belly, the next step would be to add a hand around their chest. Stay. Again, we would start very quick. For dogs that are extremely nervous, you may even start with just patting or scratching at the chest. Release and feed them with a treat, or have someone feed them the entire time. Slowly work further so that you're more snug. Moving our hand a little closer over the shoulders and gradually working up to being able to do the full hug. If you have a dog that's very tactile sensitive, that whole process could take several weeks just to get them comfortable with the basic hug itself. Either way, once you get the hug comfortable with the dog, then it's just a process of adding that time and the level of kind of snugness of the hug. The next thing we do is work on getting the dog used to, can you sit? Basic aspects of the exam. Stay. Most dogs that are aggressive, anxious, or fearful at the vet are feeling that way simply because they're afraid of what we're going to do. They're worried it's going to hurt, or they don't know what we're going to do, and it's very stressful to them. Once we teach them what they're going to do each time, then the dog is no longer as afraid, doesn't have any reason to be afraid because they know what's going to happen. So we take those previously scary, unknown things and turn them into a very predictable pattern or a game that the dog can enjoy. I usually have people start by simulating vaccinations or injections. That can easily be done by starting with just pinching the dog's skin a little bit. 1 pinch, 2 pinch. Dog can eat the entire time we're pinching. Pinch, and stop with the food, and pinch, and then release again, and pinch, and get the dog comfortable with that pinching. Once you have a dog that's very comfortable with the pinching itself, wait. For this we have to do pay as you go because I don't have enough hands. Wait. You can do pinch, pinch, and simulate a vaccine by either pushing a actual syringe without the needle out into the dog's skin very lightly. If you don't have a syringe, then you can simply use any kind of an object like a pen or a pencil that would be about that same length. A pinch and a little bit of a poke, which is not bothering Maddie at all. She's about to give herself some open bar technique. Yeah, that's your reward for that. Once that part is done, we move on to basically all the other aspects of the exam. We would start typically with some body handling. It's important to note that if your dog has any particular areas of their body that are particular triggers for them, that are very difficult for them to have handle, they may have had previous painful experiences or something else that makes them particularly fearful. Frequently these can be feet, sometimes ears, or even sometimes the mouth. Be aware if your dog has a very strong trigger area that you want to work on that area last. We're going to kind of walk through a 1, 2, 3 step procedure of the things that we're going to, the process we're going to use, but you don't have to do it the same order for every dog. So just be aware of what might be more challenging for your dog and then save that for last. I'm going to start with Maddie by just getting her comfortable here with some basic body handling. Can you wait? Good girl. Running your hand down the length of your dog. Good girl. All the way down to their tail, lifting the tail gently and releasing. Again, if your dog is more nervous with handling, you may need to break this down. Most dogs are comfortable having this done by their owners. As many repetitions as needed till they're comfortable. Once they're comfortable with this, running down the back and lifting the tail, the next step of an exam would be the abdominal palpation, where the doctor feels their belly. To do this, simply squeeze gently on either side of your dog's belly. You don't have to push very hard. It's just a matter of getting the dog comfortable. And reward with a treat. Good girl. Maddie's now tolerant of the handling down the back and of a gentle squeeze of the belly. Once your dog is comfortable having its back and tail handled and the belly squeezed, the next step is handling all 4 feet. For some dogs, this can be a significant trigger if they're nervous about having their feet handled. Good girl. If your dog is very anxious about having their feet handled, we're going to just have you not go all the way down to their feet. This can be done with the dog standing or sitting. Maddie's getting a little tired of us, so she would like to sit for a little bit. So the basic process here, would be running your hand down their leg. If the dog's comfortable having their feet handled, you can pick them up by their foot. If not, just pick up by the wrist, hold, and release. Very good. And again, delivering the treat while I start handling. She's chewing on a piece of chicken while I hold the foot, and release. You would continue this with all 4 feet. Stand. Thank you. Good girl. Right here. Down to the back leg. Lifting again at the ankle or the foot, depending on the dog's comfort. And stop delivering the food when the handling stops. Stay. Once the dog is comfortable with basic handling of each leg, the next step would be to do a little bit of squeezing on a couple different limbs. This would simulate holding off a vein for a blood draw or a detailed examination of potentially an injured foot or leg. Running your hand down the foot and then giving it a squeeze over the meaty part of the back leg. And stop. The front leg would be just giving a squeeze at the elbow, the dog's elbow, holding pressure for a few seconds and release. Very good. Once your dog is completely comfortable, you sit, with having its body handled, its belly squeezed, and all 4 legs manipulated, the only thing left is the head and face exam. For this, we need to be able to look in the ears, look in the eyes, and just lift the lip to look in the mouth. When you look in one ear, look in the other ear, and stop. Very good. In her mouth, they can be snacking on some food while you lift the lips. Take a look at those beautiful teeth. Yes. Good girl. Very good. Looking at those teeth. Good girl. Excellent. And at this, I'm just taking a look in her eyes, pulling very gently on her eyelids. Yes. So she gets comfortable with that feeling. Very good. Good job. You're all done. Excellent. So that video just demonstrates for you the aspects of a veterinary exam and handling that you can work with at home with your dog. Again, please remember that this is not something you would proceed through all steps in one session. For different dogs, you may find that you spend even several sessions working on just one area of their body if it's a particular trigger. However, this is what you would want to work towards at the end, that your dog would be comfortable for several treats, having the restraint done and having the exam done as well. This process frequently prevents a variety of fear, anxiety, and aggression at the vet and makes your patients, your pets rather, our patients, easier to handle and makes them happier to be at the clinic, and it provides an all-around more positive experience for everybody. If you have more specific questions about how to do a counter conditioning program or want to set one up for your dog, please call our office.